Medical decision-making is a partnership, where medical expertise meets patient values and interests. Together, providers and patients work toward care options that truly benefit each individual patient. Every patient brings their own health conditions, values, and life circumstances. It is the responsibility of medical providers, with their specialized knowledge, to determine the reasonable scope of medical options that fit within those realities. But sometimes, challenges emerge. Especially in critical care, providers may believe that the decisions made by patients or families will lead to what sometimes are called futile, but probably are best understood as medically inappropriate, treatments. Imagine a geriatric patient with severe dementia whose family insists on a feeding tube, or a patient with heart failure whose advance directive demands all intensive measures, or even a young child with brain injury whose parents hope for recovery through aggressive interventions. In these and other similar cases, providers may say something like, "The family insists on futile care," or "We feel like the patient is suffering." Families, meanwhile, may say, "Our loved one is a fighter," or "We can't be the ones to let them die." In these moments, providers must carefully consider not only what they believe is best, but the full scope of reasonable, if not always optimal, medical options. Of course, the provider's own biases can creep in, so collaboration with colleagues and ethicists is essential. Disagreements can arise for many reasons. Providers haven't always clearly defined reasonable care. Providers may fail to engage with families. Families, on the other hand, may choose suboptimal but still reasonable options. Families may choose options that cannot work. Families might choose options unlikely to benefit the patient, and families choose options that, in the provider's estimate, will actually cause harm. Of course, each of these situations can cause distress, but whether or not they are problematic needs careful consideration. In 2015, a multi-society professional task force clarified terms and concepts to help understand where challenges lie. They defined and distinguished two important concepts that often get confused in these cases. They defined futility, and they defined potentially medically inappropriate treatment. Futile care they defined as an intervention that cannot achieve its physiologic goal, like antibiotics for a viral infection. Such interventions should never be offered. But most cases are not truly futile in this way. Instead, they are potentially medically inappropriate. They are treatments that may not benefit the patient, or worse, may in fact cause harm. Because judgments regarding appropriateness of medical options and whether or not the options are beneficial are complex judgments prone to bias, the task force recommended a structured process for resolving any conflicts among providers and between providers and patients and families. They said you should consult with experts, seek an ethics review, involve an outside provider, and bring the case to a multidisciplinary committee. It is important to recognize that consensus could go the way of supporting the patient or family's request as not being medically inappropriate, and thus the team should provide the care requested. Either way, it is important to continue good, professional, caring communication among all parties. By running through each step in the process, consensus may be reached, and if the consensus deems a treatment to be inappropriate, providers may refuse it. Of course, even in such cases, families must always be offered a second opinion or transfer. And whether or not consensus is reached, individual providers have the right to step away from care of a patient based on their conscience claims. In the end, most medical decisions are collaborative and smooth, but when conflicts arise, distinguishing between futile and potentially inappropriate medical treatments, and following fair processes, all help ensure that decisions honor both medical integrity and patient values.